Hey, Alpha Nurses, I'm Licensure from alphanursguide.com. This is hematological practice questions. Without the way, let's get started.
These activities are included in the care plan for a 78-year-old patient admitted to the hospital with anemia caused by possible gastrointestinal bleeding. Which activity can the nurse delegate to an experienced assistive personnel? 1. Obtaining stool specimens for the fecal occult blood test. 2. Having the patient sign a colonoscopy consent form. 3. Giving the prescribed polyethylene glycol electrolyte solution. 4. Checking for allergies to contrast dye or shellfish. The correct answer is 1. Obtaining stool specimens for the fecal occult blood test. An experienced AP will have been taught how to obtain a stool specimen for the fecal occult blood test because this is a common screening test for hospitalized patients. Having the patient sign an informed consent form should be done by the healthcare provider who will be performing the colonoscopy. Administering medications and checking for allergies are within the scope of practice of licensed nursing staff. The nurse is preparing to have a patient who has acute leukemia sign the permit for a bone marrow aspiration. The patient states that the oncologist has explained the procedure and the complications, and she has no further questions. What assessment is most important for the nurse to complete before the procedure is carried out? 1. Review the patient's do not resuscitate status. 2. Review the platelet count. 3. Review the leukocyte count. 4. Ask when the patient ate last. The correct answer is 2. Review the platelet count. The most important assessment to carry out before the procedure is to review the platelet count to ensure that the platelets are within normal limits. A complication of a bone marrow aspiration is bleeding, and platelets are necessary for normal clotting to take place. The nurse should also review the prothrombin time, partial thromboplastin time, and international normalized ratio for the same reason. A patient's DNR status should be reviewed in case of an emergency on all ill patients as a general rule. The leukocyte count in leukemia is expected to be altered and is not important when considering the bleeding complication. Usually, it is not necessary for a patient to be NPO before the procedure. When the nurse is assessing a patient with chronic kidney disease who is receiving epoetin alpha injections, which finding most indicates a need to talk with the healthcare provider before giving the medication? 1. Hemoglobin level is 8.9 grams per deciliter. 2. Blood pressure is 198/92. 3. The patient does not like subcutaneous injections. 4. The patient has a history of myocardial infarction. The correct answer is 2. Blood pressure is 198/92. Epoetin alpha can cause hypertension, and blood pressure should be controlled before administering the medication. Because patients with chronic kidney disease have chronic anemia, a hemoglobin level of 8.9 grams per deciliter is not unusual. Although the nurse could ask the HCP about IV administration of the medication, subcutaneous administration requires a lower dose of the medication and is preferred. Epoetin alpha can cause angina or myocardial infarction, but the risk is highest when hemoglobin levels are greater than 11 grams per deciliter. A patient who has sickle cell disease is admitted with vaso-occlusive crisis and reports severe abdominal and flank pain. Which of the analgesic medications on the pain treatment protocol will be best for the nurse to administer initially? 1. Ibuprofen 800 mg PO. 2. Morphine sulfate 4 mg IV. 3. Hydromorphone liquid 5 mg PO. 4. Fentanyl 25 micrograms per hour transdermal patch. The correct answer is 2. Morphine sulfate 4 mg IV. Guidelines for the management of vaso-occlusive crisis suggest the rapid use of parenteral opioids for patients who have moderate to severe pain. The other medications may also be appropriate for the patient as the crisis resolves, but are not the best choice for rapid treatment of severe pain. The charge nurse is making the daily assignments on the medical surgical unit. Which patient is best assigned to a float nurse who has come from the post-anesthesia care unit? 1. A 30-year-old patient with thalassemia major who has an order for subcutaneous infusion of deferoxamine. 2. A 43-year-old patient with multiple myeloma who requires discharge teaching. 3. A 52-year-old patient with chronic gastrointestinal bleeding who has returned to the unit after a colonoscopy. 4. A 65-year-old patient with pernicious anemia who has just been admitted to the unit. The correct answer is 3. A 52-year-old patient with chronic gastrointestinal bleeding who has returned to the unit after a colonoscopy. A nurse who works in the post-anesthesia care unit will be familiar with the monitoring needed for a patient who has just returned from a procedure such as a colonoscopy, which requires moderate sedation or monitored anesthesia care. Care of the other patients requires staff with more experience with various types of hematologic disorders and would be better to assign to nursing personnel who regularly work on the medical surgical unit. After the nurse receives a change of shift report, which patient should be seen first? 1. A 26-year-old patient with thalassemia who has a hemoglobin level of 8 grams per deciliter and orders for a blood transfusion. 2. A 44-year-old patient admitted 3 days previously for sickle cell crisis who is scheduled for a computed tomographic scan. 3. A 50-year-old patient with stage 4 non-Hodgkin lymphoma who is crying and saying, "I'm not ready to die." 4. A 69-year-old patient with chemotherapy-induced neutropenia who has an oral temperature of 100.1 degrees Fahrenheit. The correct answer is 4. A 69-year-old patient with chemotherapy-induced neutropenia who has an oral temperature of 100.1 degrees Fahrenheit. Any temperature elevation in a neutropenic patient may indicate the presence of a life-threatening infection, so actions such as drawing blood for culture and administering antibiotics should be initiated quickly. The other patients need to be assessed as soon as possible, but are not critically ill. A patient with sickle cell disease is admitted with splenic sequestration. The blood pressure is 86/40 and heart rate is 124 beats per minute. Which of these actions will the nurse take first? 1. Complete a head-to-toe assessment. 2. Draw blood for type and cross-match. 3. Infuse normal saline at 250 ml per hour. 4. Ask the patient about vaccination history. The correct answer is 3. Infuse normal saline at 250 ml per hour. Because the patient is severely hypotensive, correction of hypovolemia caused by the splenic sequestration is the most urgent action. Nevertheless, the other actions are appropriate because a complete assessment will be needed to plan care, a transfusion is likely to be needed, and vaccination history is pertinent for patients with sickle cell disease. Infusion of saline, however, is the priority need. The nurse is making a room assignment for a newly arrived patient whose laboratory test results indicate pancytopenia. Which patient will be the best roommate for the new patient? 1. Patient with digoxin toxicity. 2. Patient with viral pneumonia. 3. Patient with shingles. 4. Patient with cellulitis. The correct answer is 1. Patient with digoxin toxicity. Patients with pancytopenia are at higher risk for infection. The patient with digoxin toxicity presents the least risk of infecting the new patient. Viral pneumonia, shingles, and cellulitis are infectious processes. When administering a blood transfusion to a patient, which action can the nurse delegate to the assistive personnel? 1. Take the patient's vital signs before the transfusion is started. 2. Ensure that the blood is infused within no more than 4 hours. 3. Ask the patient at frequent intervals about the presence of chills or dyspnea. 4. Assist with double-checking the patient's identification and blood bag number. The correct answer is 1. Take the patient's vital signs before the transfusion is started. AP education and role includes obtaining vital signs, which will be reported to the nurse before the initiation of the transfusion. Monitoring for transfusion reactions, adjusting the transfusion rate, and ensuring that the blood type and number are correct require critical thinking and should be done by the nurse. A 67-year-old patient who is receiving chemotherapy for lung cancer is admitted to the hospital with thrombocytopenia. Which statement made by the patient when the nurse is obtaining the admission history is of most concern? 1. I've noticed that I bruise more easily since the chemotherapy started. 2. My bowel movements are soft and dark brown. 3. I take ibuprofen every day because of my history of osteoarthritis. 4. My appetite has decreased since the chemotherapy started. The correct answer is 3. I take ibuprofen every day because of my history of osteoarthritis. Because nonsteroidal anti-inflammatory drugs will decrease platelet aggregation, patients with thrombocytopenia should not use ibuprofen routinely. Patient teaching about this should be included in the care plan. Bruising is consistent with the patient's admission problem of thrombocytopenia. Soft, dark brown stools indicate that there is no frank or occult blood in the bowel movements. Although the patient's decreased appetite requires further assessment by the nurse, this is a common complication of chemotherapy. Which of these patients who have just arrived at the emergency department should the nurse assess first? 1. Patient who reports several dark, tarry stools and a history of peptic ulcer disease. 2. Patient with hemophilia A who is experiencing thigh swelling after a fall. 3. Patient who has pernicious anemia and reports paresthesia of the hands and feet. 4. Patient with thalassemia major who needs a scheduled blood transfusion. The correct answer is 2. Patient with hemophilia A who is experiencing thigh swelling after a fall. Thigh swelling after an injury in a patient with hemophilia likely indicates acute bleeding, which can compromise blood flow and nerve function in the leg, and should be treated immediately with the administration of factor replacement. The other patients also need assessment, treatment, or both, but the data do not indicate any immediate threat to life or function. After a car accident, a patient with a medical alert bracelet indicating hemophilia A is admitted to the emergency department. Which action prescribed by the healthcare provider will the nurse implement first? 1. Transport the patient to the radiology department for cervical spine radiography. 2. Transfuse factor VII concentrate. 3. Type and cross-match for 4 units of packed red blood cells. 4. Infuse normal saline at 250 ml per hour. The correct answer is 2. Transfuse factor VII concentrate. When a hemophiliac patient is at high risk for bleeding, the priority intervention is to maximize the availability of clotting factors. The other prescribed actions should also be implemented rapidly, but do not have as high a priority as administering clotting factors. A patient with chemotherapy-related neutropenia is receiving filgrastim injections. Which finding by the nurse is most important to report to the healthcare provider? 1. The patient says, "My bones are aching." 2. The patient's platelet count is 110,000 cubic milliliters. 3. The patient's white blood cell count is 39,000 cubic milliliters. 4. The patient reports that the medication stings when it is injected. The correct answer is 3. The patient's white blood cell count is 39,000 cubic milliliters. Leukocytosis is an adverse effect of filgrastim and indicates a need to stop the medication or decrease dosage. Bone pain is a common adverse effect as the bone marrow starts to produce more neutrophils. The patient should receive analgesics, but the medication will be continued. Stinging with injection may occur. The nurse should administer the medication more slowly. The patient's platelet count is low and should be reported, but the level of 110,000 cubic milliliters does not increase risk for spontaneous bleeding. The home health nurse is obtaining a history for a patient who has deep vein thrombosis and is taking warfarin 2 milligrams per day. Which statement by the patient is the best indicator that additional teaching about warfarin may be needed? 1. I have started to eat more healthy foods like green salads and fruit. 2. The doctor said that it is important to avoid becoming constipated. 3. Warfarin makes me feel a little nauseated unless I take it with food. 4. I will need to have some blood testing done once or twice a week. The correct answer is 1. I have started to eat more healthy foods like green salads and fruit. Patients taking warfarin are advised to avoid making sudden dietary changes because changing the oral intake of foods high in vitamin K will have an impact on the effectiveness of the medication. The other statements suggest that further teaching may be indicated, but more assessment for teaching needs is required first. The nurse is reviewing the complete blood count for a patient who has been admitted for knee arthroscopy. Which value is most important to report to the healthcare provider before surgery? 1. Hematocrit of 33%. 2. Hemoglobin level of 10.9 grams per deciliter. 3. Platelet count of 426,000 cubic milliliters. 4. White blood cell count of 16,000 cubic milliliters. The correct answer is 4. White blood cell count of 16,000 cubic milliliters. Centers for Disease Control and Prevention guidelines for the prevention of surgical site infections indicate that surgery should be postponed when there is evidence of a pre-existing infection, such as an elevation in white blood cell count. The other values are slightly abnormal, but would not be likely to cause post-operative problems for knee arthroscopy. A patient is admitted to the intensive care unit with disseminated intravascular coagulation associated with a gram-negative infection. Which assessment information has the most immediate implications for the patient's care? 1. There is no palpable radial or pedal pulse. 2. The patient reports chest pain. 3. The patient's oxygen saturation is 87%. 4. There is modeling of the hands and feet. The correct answer is 3. The patient's oxygen saturation is 87%. Because the decrease in oxygen saturation will have the greatest immediate effect on all body systems, improvement in oxygenation should be the priority goal of care. The other data also indicate the need for rapid intervention, but improvement of oxygenation is the most urgent need. The nurse is providing orientation for a new nurse who is preparing to administer packed red blood cells to a patient who had blood loss during surgery. Which action by the new nurse requires that the nurse intervene immediately? 1. Waiting 20 minutes after obtaining the PRBCs before starting the infusion. 2. Starting an IV line for the transfusion using a 22-gauge catheter. 3. Priming the transfusion set using 5% dextrose in lactated Ringer's solution. 4. Telling the patient that the PRBCs may cause a serious transfusion reaction. The correct answer is 3. Priming the transfusion set using 5% dextrose in lactated Ringer's solution. Normal saline, an isotonic solution, should be used when priming the IV line to avoid causing hemolysis of red blood cells. Ideally, blood products should be infused as soon as possible after they are obtained. However, a 20-minute delay would not be unsafe. Large-bore IV catheters are preferable for blood administration. If a smaller catheter must be used, normal saline may be used to dilute the RBCs. Although the new nurse should avoid increasing patient anxiety by indicating that a serious transfusion reaction may occur, this action is not as high a concern as using an inappropriate fluid for priming the IV tubing. A patient with iron deficiency anemia who is taking oral iron supplements is evaluated by the nurse in the outpatient clinic. Which finding by the nurse is of most concern? 1. The patient reports that stools are black. 2. The patient complains of occasional constipation. 3. The patient takes a multivitamin tablet every day. 4. The patient takes an antacid with the iron to avoid nausea. The correct answer is 4. The patient takes an antacid with the iron to avoid nausea. Concurrent use of antacids with iron supplements will decrease absorption of the iron and decrease the efficacy in resolving the patient's anemia. Black stools are expected when taking oral iron. The patient's occasional constipation may indicate a need for information about prevention of constipation while taking iron. Use of a multivitamin tablet is safe when taking iron supplements. A 32-year-old patient with sickle cell anemia is admitted to the hospital during a sickle cell crisis. Blood pressure is 104/62, oxygen saturation is 85%, and the patient reports pain at a level 8. Which action prescribed by the healthcare provider will the nurse implement first? 1. Administer morphine sulfate 4 to 8 milligrams IV. 2. Give oxygen at 4 liters per minute via nasal cannula. 3. Start an infusion of normal saline at 200 ml per hour. 4. Apply warm packs to painful joints. The correct answer is 2. Give oxygen at 4 liters per minute via nasal cannula. National guidelines for sickle cell crisis indicate that oxygen should be administered if the oxygen saturation is less than 95%. Hypoxia and deoxygenation of the blood cells are the most common cause of sickling, so administration of oxygen is the priority intervention here. Pain control and hydration are also important interventions for this patient and should be accomplished rapidly. A 22-year-old patient with stage 1 Hodgkin disease is admitted to the oncology unit for radiation therapy. During the initial assessment, the patient tells the nurse, "Sometimes I'm afraid of dying." Which response is most appropriate at this time? 1. Many individuals with this diagnosis have some fears. 2. Perhaps you should ask the doctor about medication. 3. Tell me a little bit more about your fear of dying. 4. Most people with stage 1 Hodgkin disease survive. The correct answer is 3. Tell me a little bit more about your fear of dying. More assessment about what the patient means is needed before any interventions can be planned or implemented. All of the other statements indicate an assumption that the patient is afraid of dying of Hodgkin disease, which may not be the case.
You can get my NCLEX review course. Links will be in the description. I'll see you guys in the next video.